Hey GP learners, many of you probably have the challenges of trying to use your computer systems remotely, whether that's at home or in other areas because of change within your practice. And in some places, it's been a real challenge to get this sorted because of IT issues and all that kind of stuff. Well, in this episode, I'm going to talk to Dr. Nicholas Grundy, who's found a solution that's worked for his local area and meant that their area can basically run smoothly. As always, we're here to try and help, and let's tech enhance your primary care and learning. This is the first time I'm meeting. I'm Dr. Gandalf, GP Learning, where I'll supporting you with technology-enhanced primary care and learning. And in this episode, I'm joined by Dr. Nicholas Grundy, who's going to talk to us about how you can access clinical systems safely and effectively in order to keep your practice running, and particularly with our current COVID challenges, just make your practice run hopefully a lot smoother. How are we doing, Nick?
All right. How are you, Sam?
Nah, not too bad, thanks. So do you mind just filling us in who you are? Because some of our GP learners may not be aware of who you are and what you do.
So we share roles on GPSurvival. So I'm chair of that, your treasurer. But I'm mainly a GP partner in South West London, and I'm chair of our local federation, the Richmond GP Alliance, and that's really where this work came from.
Cool. And I know that we talked before this about how you basically gone off and created a system that meant that practices can still effectively use their systems remotely, partly because of various challenges that you've had. And obviously we've got our biggest one, the massive disruptor that everyone's having to face, which is COVID, that meant that basically this needed to happen to keep people safe. So talk us through, what kind of happened.
So, yeah, I mean, I think we all have similar problems around the country. I think people have tackled this in different ways. But the fundamental thing, like you say, was whether people were self-isolating and needed to be able to work from home, or whether, as we did, you wanted to get staff working from home routinely to minimise the risk of transmission in the surgery from staff to staff. You needed something that worked and that let them do everything they could from home that they can at work. And so that was the driver for us. And I think we had issues with the official solution being a bit slower than we'd like it to be, and being less available than we wanted it to be. So we took a look at what was out there and came to the solution we're going to talk about.
Mm-hmm. And you're definitely right there. I mean, many practices will have the challenges of either people being off sick and then having to continue isolating once they've felt better to fulfill the designated guidance, or potentially, we have lots of staff that may be in the shielding category that will potentially be off for a whole 12 weeks. And what do you do in terms of enabling them to still have some support, but at the same time not feel like they've been left out on the cold and stuff? And a lot of this is giving them access to the system until they get that. That's a challenge. Then obviously the big other one is the tech in order to do so, because a lot of places obviously have lockdown, IT computers, laptops, whatever, and there's clearly a need for a sudden increase in this, and trying to get supply of that is a real challenge. I mean, many GPs will know the challenge of trying to find just a simple webcam right now doing video consultations with, let alone an IT approved secure laptop. So, finding solutions that mean that those problems are not an issue, really useful. I know various places have got various different solutions. I know in Nottingham, where I work, they've just released fairly recently a really good solution that enables this to work from people's homes computers and effectively does what you're about to show us. So yeah, why don't we show us?
Sure. I'll just share the screen here. So that's actually the web interface, which we probably don't need to see. We talked about earlier, but this is the tool. It's a bit of software called Real VNC, and it's a commercial bit of software used by lots of organizations around the country and around the world. And the first thing you need to do to get access to it, there's a registration process that I won't show you, but once you get to this point, you need to sign in, and that's most people, it's the NHS email. And you put password in, hopefully I've got that right, yeah. And then this bit's the two-step verification. Now you probably know more about this than me, so why don't you explain what that is while I get the code up?
Yeah, so many people will probably recognize this from things like banking solutions and that kind of stuff, and it's just to add an extra layer of security to confirm you are who you say you are. So this can be either through text messaging that many people probably have experienced, or certain apps like Google Authenticator or Authy or other kind of apps that basically, once it's set up and it's confirmed that you're you, moving forward, you then get a code to basically give a second approval process that it's definitely you that's logging in and not somebody else.
That's exactly right, and you can use both those tools that you mentioned, Authy and Google Authenticator, with Real VNC. So that does work. I'm just going to maximize this screen. And what you can see now is that now that I'm logged in, first of all, my name appears in the top corner there, and because I've got access to two different surgeries, I can see computers from both those surgeries listed along here. So those are just two different surgeries that are in my area in Richmond. And the tool's quite flexible. So if you talk to a practice manager at one of the other practices, if, say, a practice went down and you needed to do some work for that practice, you can get access to these computers very easily. They just log onto the website, they give you access there, and they would pop up on the screen pretty much immediately. We haven't had to do that yet, but it's been nice to have the option to.
Mm-hmm. So you mentioned that you can see the computers. Can you just explain a little bit more about what you mean by see the computers?
Yes, so these are computers physically at the two different sites that are listed there, which have had the server software installed on them. So someone in that practice has decided to make those available for remote use. So it's not all the computers, it's the ones that have been designated for this use. And so there's 6 here that are at my practice, which are on. If they're not switched on, they won't show up on here generally. Does that answer the question?
Yeah, definitely. And I can see that you've got one from another practice there. So if you didn't have, for example, the rights to use that computer, does this mean that you can actually go in and start using it?
No. So in fact, although that's showing up on my list, I couldn't access that computer because I don't have a username or a login. Because to get onto them, you need to have the Windows username and logon for them. So I would need to call that practice manager and ask for a locum login or for a temporary login to get onto that computer. I could show you that not working, but yeah, we'll see it when we log into one of the ones I can access, that without a Windows password, you can't get into it anyway. So what it does is it effectively sits you in front of the computer at work. And if I was sat in front of a computer at practice I don't work at, I couldn't get into it. Same applies with this. Okay.
And if somebody else was using that current computer that you logged into, would that work, or would it be something weird?
Both. So it does work, and it is a bit weird because you're both controlling the mouse and you can both type. So that can be useful if someone wants technical support with something. And there's always glitches with these things. I think if you let the remote screen, if you let the screen go onto the screensaver, then if you're remoting into a different screen, sometimes the screen changes and the display needs sorted out. Mm-hmm. So you can remote into a computer that someone else is using and fix that for them. So it has got some uses. But generally, if I log into a computer now and someone else is on it, I'll log off and find a different one.
Yeah. And I guess to explain to people that haven't had this experience or quite understand it, it's pretty much the same as when you call IT support and they try and fix your computer and you're in practice. It's that weird experience of you try and move the mouse, they move the mouse and all that kind of stuff. But it does work. And it's important to recognize that because we're going to come on to the security part of it in a second. But it effectively means that you can use the computers that have been approved to do so. Obviously, with people going off and potentially shielding or not being able to work, that does mean that practices should theoretically have some stations available to use. So clearly understandable how practices could enable this to happen. But I think from what you're telling me, there are certain things you have to have in place. So I think the smart card's the big one, isn't it?
Yeah, that's right. So this system doesn't let you at the moment have your smart card in a reader at home. It won't pass that through to the work computer in the way that some other systems do. Mm-hmm. So we've got around that just by leaving the smart card physically in a computer at work.
Mm-hmm. So I think it's important to recognise that there does need to be some ability of preparation and that kind of stuff to enable this to work because of that issue that you can't just use your smart. I mean, I guess you could use the computers without the smart card and use a physical login to get into your system. Obviously, the downside to that is then you won't be able to access the spine. So certain things like EPS prescriptions, referrals, that kind of stuff won't work. And therefore you have to figure out other workarounds for those kind of things, which can be challenging sometimes and more frustrating. But shall we have a look and see what it looks like when you try and log in?
Yeah, sure. So we've got some old computers we repurposed. They're waiting to be collected, but we basically use them as extra computers, which are just sitting headless. So that means without a kind of monitor attached to them. So I'm just going to log into one of those. And what you can see here is this authentication window, and it's asking for a username and password. Now, because I've logged into this one before, it knows what my username is. But this is asking you effectively for the Windows password for the computer at work. So I just put that in. And what it takes you to then is to the computer at work, but it's in a logged off state. So even knowing that, I can't get onto the computer without putting that in again. Can you see that all right?
Yep. No. So we can see that we've got the control on delete log on screen for the PC, and obviously you would then input the information, I'm assuming, and then that should let you in.
Exactly right. Now for Windows 10, that's a bit different. This is a Windows 7 computer. Windows 10, you can just click the mouse. Because you have to do a control delete for this one, there's a bar at the top where it pops down. Because if you press control delete on your home computer, it'll think you're doing it on that one.
Yeah. So
that just sends that signal through. And again, this is just the same process that I imagine everyone has logging onto their computers at work normally.
Mm-hmm. And how much of a slowdown do you feel this causes compared to using the computers fresh?
I mean, this is a slow computer because it was about to be collected and recycled. So I think it's equivalent sitting in front of it. I've not had any issues with network speeds or with slowdowns. Sometimes the video tears a bit. I think you saw that it can kind of judder a bit, but that doesn't slow things down appreciably that I've noticed.
Okay. And as you said, because your smart card's already in this computer, that's already pinged up, asking for your approval and stuff.
Yeah.
And so basically you'd be able to sign into whichever clinical system you're using at the moment. Is that correct?
Exactly right. So we actually use a remote system. So we're a vision practice. So I'm going to, having logged into it from home to a computer at work, I'm now going to log in from the work computer to a server somewhere else, which is not confusing at all. But I'll just do that so you can see how that works. And obviously this is extra layers of security in some ways. And I'll just call up DocMan, the clinical system, so you can see those.
And there we go.
Good. So there's the Vision home screen. I've got access to that as if I was sat in front of it at work, and I can do everything I'd normally do on that. I obviously won't open anything from there, but that's there. We talked about printing earlier as well, didn't we? So if I print something from within Vision, again, it will behave as if I were at the work computer. So it will print it to a computer at work. You can obviously save things and you can then download them and print them at home, but generally we found that's less useful than having reception collect them and action them as they normally would.
And effectively, this is also important to recognize that this is a secure system. So the data encryption and everything is effectively preventing somebody else from being able to hack in. I guess important to recognize that that station is live. So theoretically, somebody in your practice could walk over and start using the computer. So I think it's important to, if you were looking at this kind of process, having really good processes that the moment you stop using the computer for whatever reason, even if that's you just going to go get a cup of tea, you need to log out and log back in to prevent that from being a problem. Because if I'm right, the moment you log out, nobody else can then use your access to do anything.
Exactly right. Yeah. I mean, with this particular computer, it wouldn't work because there's no monitor attached. They would have to physically attach it to a monitor. But yeah, in principle, you're exactly right. You should lock the computer as normal when you walk away from the keyboard, and you should log out when you're done. In fact, should we do that now? Should I just show you how to?
Yeah, sure.
So I mean, you log out of DocMan things in the usual way. Oh, something's unhappy. Oh, that's good. Look, runtime error, marvelous. So first of all, you would log off from this. Just again, confusing. I mean, we're logging off from the Vision remote session now. And then you get back to the work computer. This is the work computer desktop. Again, what you do there is you just log off from it there.
Fine.
And then what that will do in a minute is it will take you back to the login screen for that computer.
And I guess important to remember that in this situation, you would be logging off, not shutting down. Because if you shut down, you're going to have to ring up the practice to switch the computer back on.
Yeah, exactly.
And then we're out of it.
We are. And then you can come out of the remote session. You can then close the remote session at the top there. You see where it says end session.
Okay.
Confirm you want to do that, and then you're back to the main thing.
And I think, so and I know you mentioned about how VNC allows you to dial into these kind of systems. You know, if somebody was interested in exploring this as a solution for their area, you know, what kind of pricing, what kind of systems are we looking at in order to enable that to happen?
So we bought about 400 licenses in Richmond for something like 2,500 for a year. And that's the enterprise license, which gives you a bit more flexibility in how you use it and how you use the security than the lesser options. I think the reason that we ran with it was partly that some of our practices have used it locally and liked it. And also we ran a free trial. So you can use it for free for a month for up to 8 computers to see if you like it. So we did that. And in the space of 48 hours, we decided that, yeah, this would work. And then we went to our CCG, who agreed to fund it over their system, partly because it was a lot cheaper. But I think if you are a practice that's sort of stuck with a remote working system that perhaps isn't working the way you want it to, you can just set this up, try it out, see if you like it, and then buy it if you do. You do need administrator access to your work computers to install the server software, and some sort of IT support people are sort of more willing to do that than others. But I think you were saying earlier, saying it's a level 4 crisis. Just tell them that until they do what you need them to. You know?
Yeah, and I think it's important to recognise that right now we are in a situation where the needs of trying to make sure that we can provide care in some senses outweighs other things. I think it is also important to remember that security still needs to be there. Quite rightly, there still needs to be some element of jurisprudence to make sure that things don't break. And clearly, you don't want to have a WannaCry situation on top of our current challenges.
Yeah.
So therefore, there needs to be security. But, it is important to remember that this system is secure. As you said, this is used by multiple businesses across the world. It is a secure portal that allows you access to the computers. And as long as your processes and protocols of using it are clear cut and adhered to, then it would be as safe as if you were in the practice doing the work yourself effectively.
I think you're right. There's a technical element to this, isn't there? Where is the software itself secure? Well, the connection's end-to-end encryption. I think it's 256-bit AES, so it's that's as secure as it gets, more or less. And I think there's then a practical thing. At the moment, our receptionists normally walk around at the end of the day and they turn all the computers off. So we just have to tell them go around at the end of the day and make sure they're all logged off rather than turned off. Mm-hmm. And that's a relatively easy change to make. But you're right. There's the human element and the software element, isn't there? So yeah.
I think the key benefit is that you're effectively enabling your practice team to continue functioning. And, worst case scenario, if, the building had to be repurposed, for example, you could suddenly move your practice to another system from working from home. For the majority of people, there's that smart card issue that kind of needed to be figured out. But, as long as one person can go into the building and sort that out, you're probably okay to do. And you could even support other practices. So if we're looking at it from a network or federation perspective, you can support other practices that may be struggling, if the situation was to progress further, that we are having. And I know there are some areas where some practices are just literally on skeleton crews, if not less than that. Clearly there is potential benefit in being able to work remotely.
Absolutely. We're going to use this to run sort of simulated practice closures next week, actually. So we're going to check that it works in that situation. If you need to move staff physically out of one building into another, can they use this to give them the computers normally? And from the sort of network working side of things, we've had PCN pharmacists and we've got our CCG pharmacists using this to work across multiple different sites. Mm-hmm. And the way we've done that is they've logged into one computer that has a smart card in, and then they can dial into different remote servers from a vision point of view. I think with EMIS you can do that anyway, so the same principle would work. But it definitely works for that, and we've been using it for that. So it's flexible in that sense.
Mm-hmm. I know one thing we talked about earlier before we started this call is the fact that it's important to recognise that licenses are per computer rather than necessarily per user, and I think that's one of the reasons why that works out really effective. Then is you won't necessarily need to have a license for every member of the practice, which obviously would mean more licenses. Because it's per computer, in reality, even larger practices won't need to have every single computer have this on. So therefore, you can, in a sense, throttle the number of users a bit more effectively and make it more bang for your buck, for lack of a better term.
Yeah, I think one of the selling points when we were talking to South West London was that their official solution is a cost per user, and that cost per user per year was significantly higher than the cost per computer for Real VNC. So it does work out a lot cheaper. And like you say, it means you can sit down, once the crisis is over, if you want to keep using it, you can sit down and say, well, how many do we actually need going forward on a sort of day-to-day basis, and just pay for those.
Yeah, and I think particularly once our current, COVID situation hopefully calms down, one of the things that I think many people realise is that the ability to work remotely from home or from other areas actually has significant benefits, I think, from our work-life balance. Yes, there is that element of making sure you're not overdoing it and not always switched on. But in terms of practice, resilience is a massive boon, and as more and more clinicians and patients get more used to, this whole remote mechanism of working, I think we are going to see process in place for practices to be a lot more effective, and may help with a lot of the workload challenges that many of us were facing even before COVID happened and stuff. So actually, this concept of the way that we work, I think, is going to be something that sticks with us, and being able to do this safely and effectively just means that hopefully make everybody's life a lot easier.
Absolutely, yeah.
Cool. So thank you for that, Nick. It's been really appreciative to show that kind of system, because I know that obviously the system you're using is completely different to the one I'm using, and I wanted to show people that there are other things around. Also, VNC Viewer is a public trading, kind of system and things people can easily access. And like you said, they offer a free trial, so if people wanted to have a go with it, go for it. Neither Nick nor I get anything for you guys using it or anything like that if you were to do so or anything. But yeah, definitely worth, I think, investing in if you don't have a solution that works for you locally, because it clearly does what it says and does it pretty easily as well from what we can see.
Yeah, and the other thing to say actually on that is that a lot of places in South West London have installed it, and we put together a user guide, and then Croydon in particular have refined that. So I'm happy to sort of share those if that helps.
Cool. Well, if you, what we can do is stick that in the show notes if that's all right. It sounds like it's an open document, and then people can access that if they want to have a look at it and things. And yeah, clearly happy to try and help support people as much as we can. So as always, EGP learners, if you've got any comments or questions, feel free to contact me, whichever platform you prefer. I'm on all the social media platforms, either at Dr Gandalf 52 or at EGP Learning. If you're listening on the podcast methods, make sure you subscribe and leave a review on iTunes. Love it when you do that. It's really appreciative. It's a nice little tick for me. But as well, if you're watching us on YouTube, definitely subscribe, ring the bell to get notified of all of our content, and leave a comment. I guarantee you will get a reply. And as always, EGP Learning is here to help save you and your patients time by taking hands in your primary care and learning. Catch you next episode.